members we have, of course, if they would come, that would be great. So the agenda is, we'll just follow the agenda. Number one is the MPG spending. So I submitted everything that I had spent for little things that I wanted to bring into CERT. I did offer the town $1,300 for the printer.
Mm-hmm.
And there's a mix-up as to what the date is that it was ordered.
Okay.
And it seems it was ordered July 7th, which is after the closeout date of the EMPG.
All right.
So now it's up to the town administration to decide what they're gonna do about the payment, because it's out of my hands at this point.
Okay.
The only thing that bothers me is that if they had known they couldn't have been able to get the printer or purchase it or get the purchase order or whatever sorted out before July, if they had not known, thought they could not do it, it would have been nice, because I would expect the $1,300.
On something else.
Yes, on something
Yeah.
else. But we're good. I got a scanner out of it. I got a couple radios out of it, and I got some books printed up that would be helpful if we ever had to have a response, some sort of disaster response. So I got some good things out of what I did purchase. So we'll
Okay.
try again next year.
Yeah.
Hoping, cross your fingers, toes, and eyeballs, that we have an EMPG next year. The brick is gone. Brick
Okay.
information is gone. But I want to skip down to generator. Speaking of brick, because we were sort of hoping we could use brick money to get the generator. Well, Nate and I were invited to Hardwick and sit down with them and go in on a grant together. And they want to upgrade their school. They want to put solar panels on the roof. And we've been talking. I actually found an article that we had put in for. We had actually had it on the governor's desk in 2008, and that's when it was killed right there. Just drew a line right through it. So we actually got the grant, and so our next step is to get an engineer over there, and I'm not sure the pad where the present one is going to be big enough to handle an upgraded generator. So we need to get an engineer over there and make some decisions about where it's going to be, where it's best.
So which
what
grant did we
size.
get?
It's called an MVP, and it's out of the Central Mass MRPC.
Okay.
So,
And that was to replace the generator at the school, so.
correct. That's what we specifically asked for.
Yep.
So that'll run with emergency lights.
Correct. And I said, and I was upfront, and Nate said, oh, it was no more than 50,000. I said,
Okay.
double that, maybe even triple that. So, if we go in for the engineering and everything else, that's going to be
It's gonna add some cost.
50,000 right there, and then
Right.
the generator itself is about 100,000. The one that would be sufficient. for
Yeah, 'cause
school.
the one that I had spec'd for Breezy Hill should be big enough for what we would need here to do sheltering.
Yeah. So that's that's where we are with the generator. So that's actually good news.
Okay.
So, but we've been fighting this battle for a long time.
Yeah, it would be nice to have a generator that we can use any of the buildings for,
Yeah.
if any of the buildings can be used for an actual shelter
Yeah.
instead
Yeah.
of some makeshift thing that we're trying to
Exactly
just
what
fly
we're
by
doing.
the seat of our pants.
Right.
I wonder if the one that's there, pulling that out, we could put it Breezy Hill to run the off, just like
Maybe.
Maybe the other
police, fire,
thought was-
whatever, whoever's there at the time, but at least the fire department, at least keep our garage doors working and keep lights on in an EOC.
Yeah.
Mm-hmm.
Back in 2008, they were thinking of moving this to, the school generator down to, the highway department.
I believe there's a generator on the,
There is.
on one phase of the, public safety building project, wasn't it, in the last phase or something?
Yeah, the third and final,
Yeah, the third phase of that had a generator listed,
Oh,
so I do know that's in the works, I don't know. I mean, we're a ways away from that, but
Yeah.
it's, you know, it's been thought of, so I know that they would probably wanna put a new one
mhm.
up there that'll run the whole thing once it's renovated, but
Well, my feeling is that we'll be celebrating my 80th birthday the same day we turn on the generator.
No, I'm thinking of people like my 80th birthday.
So, field day was very slow.
yeah, it seems to be getting smaller every year.
Yeah, it does.
That just goes to volunteering though too, you know, where we said, oh, people aren't volunteering as much.
No.
Field day is kinda, it's been the same for a long time, so I think interest is kinda waning a little bit.
Yeah,
you know.
the people that came to my table, they were open and receptive to taking and listening to what, and they did go through the command as well as they went through up to the frequent, they were frequent at the fire department. So there was a lot of good talk going on, but it was a small number.
Mhm.
So, like we said, we're there, everybody's living in silos now.
Well, it was a really nice day too.
Yeah.
Cause people have so much stuff to do that they're, you know, they're all doing their own thing and
Yeah, we're back to being super busy again. Okay, so, sponsored workshop, I've been sending out notices everywhere. I only have 12, if we don't get 25 signed up, I'm canceling it. But, the last time we had that was 2018, and it was 36 people, and it was and the classes were small, and they were just perfect for a lot of, chit chat and a lot of discussion and a lot of questions to be answered and all that. So even if we only get 35 people, that would be terrific. It's still 35 people. So I'm going to push through the MRC. The other night I had invited a number of other MRCs to join our training, which was virtual, and I had 30 people on virtual. So that was a good response, and I had, 12 of them were my people, so that was a good response from my end as well. So, and I have a minimum of an MRC that, if I no training was minimum 12 people. It's not worth talking to anybody if you don't have some sort of small class. But it was a good response because they were from representatives from at least 5 different MRCs, which was great. So I'm hoping that maybe if I keep pushing, I'll get people that can represent a number of different CERT teams, MRC, EMS, fire, citizens. We'll keep working on that. So I think we'll be good, but I'm beginning to wonder even if these kind of events are gonna die.
they kinda do a little bit, I think. It depends on a lot of different factors, you know, timing and all that stuff plays a role too.
But if you don't have classes and you don't have some sort of training, even if it's just a discussion,
Right.
you know, then when disaster comes, everybody sort of looks at each other and goes, what are we supposed to do? You know, and that's not good.
Mm-hmm.
So, shelter protocols is next. So I put this document together. And what I did is I had like 4 different versions of it. And I just sort of blended it all together. And my purpose was basically to have a document that would just be part of our SEM plan and just be part of our disaster planning. And it would have some protocols are not supposed to be build with, you know, first you do this, second you do that, third you do that. They're not supposed to have those kinds of details in it. It's more or less a general outline. This is the direction you should be heading in. So, and that's the way I try to put it all together. But, you know, my knowledge base for putting protocols together is somewhat limited. I was in the medical field, and this is far from the medical field. So, kind of take a moment and see what you think. Should I be adding something to it? Should I be deleting something?
I think it covers most of what you need.
Text.
One thing I see, you might want something on how you're gonna vet volunteers, or, you know, control walk-up volunteers, whether you get them or not, you know, it's just one of the things I know people have run into in the past, especially if you've got, you know, a security issue with children and,
Yeah.
or, you know, vulnerable residents,
Okay.
when you get security addressed, but,
Spontaneous.
yeah, spontaneous volunteers, would be the one I'd be concerned with, just having a protocol of what you're gonna do if they show up, like, direct them to
Yeah.
person in charge, and then, you know, anything they would be required to fill out if you don't already have their credentials on file.
Okay. Yeah, we ran into that in 2008 where we had one that came in, and most of them were just neighbors dropping off cookies. But we did have one that came in and was very helpful, but she also had a history.
Mhm.
And I sat down and had a conversation with her before I let her do anything, and I buddied her up with somebody, so she was never alone.
Yeah, that's
Yeah.
always a good plan.
Don't expect if we have a disaster, we're gonna have a ton of people showing up, but.
No, but you will get the people that just
You
wanna help.
get the ones you'd wanna be careful with.
Right.
And she did just fine. She was actually grateful that I gave her the opportunity. All right, I will make a note, tuck in a section of that. Okay, good, that was easy. I also have this little book that I figured I'd add to this, and there's also the tips book that I've already given new copies. There she is. Sorry, just in time. So this is this is a really neat guide, and I stole it from Fremont, and I sent it off, that's part of my EPG monies, I sent it off to get, printed up, because the only way this is available is online, and look at how many pictures, look at how many pages, 81 pages long.
Mm-hmm.
So,
It'd be fun to scroll.
yeah, to try to print this on,
Yeah, you have used up also quite a bit of paper here.
yes, so I had it professionally printed,
Looks good.
yeah.
Yeah.
This is a company that's a small, family-owned company that do a good job.
Yeah.
I've been working with them for years. So, she can have a copy of that. Thank you. Sorry I'm late. No, that's good. No, you're here for the major component. Did you get on?
Yeah.
Okay. All right. So the flu clinic is October 17th and 18th at the senior center. I've been pushing, trying to get it out to all kinds of ways I can get it out to whoever. I've got it in the post office. I handed it out to all the folks at 48 Gardner to pass out. So take a bunch and put them all over the place. The only place I haven't hit yet is the school. I did talk to Tony, but I need to get back to her that the age is 5 and up.
Probably call the dispatch center and they can send out one of their calls.
Yep,
That's a
when we
good
get
idea.
closer.
Yeah, I would wait till we get closer, but, they can definitely send that out, and then everybody that's signed up on the list there, actually it should hit pretty much everybody.
Everybody.
You know.
Yeah, and I was looking at maybe sending postcard, and the problem is that if, there's something called EDDM, are you aware of that?
Mhm.
So the post office has this thing where you can send it out, it's called every door, I forget what the second D is. But,
Delivery or something.
yeah, delivery or something like that. And, but unfortunately, you have to have a 6x9 postcard. So that jacks up the price of postage
Mhm.
from 24 cents to 46 cents.
Yeah, I
No
wouldn't,
surprise.
I wouldn't,
I wouldn't spend the money on.
worry
Yeah,
about
it comes out
cents
to about
now.
$1,000 if we were to do it, through the EDD. Now, I can get 2,000 postcards that are much smaller, and I'm still trying to calculate how much it would cost us for postage. I'm just wondering if that would be even worth it.
I think if you do it through the dispatch center and have them send out the call, that's gonna hit everybody just as well as something in the mail that they might not even look at, even they might just
Yeah.
throw it away.
Yeah, and posting it around town, the post office.
Yeah, we'll put it in the police station.
Senior
and,
center.
you know,
Yeah,
I think just spreading the word that way, it's
better,
much more cost effective.
yeah,
I agree.
yeah. Although I did make a nice, pretty bold color.
I'm sure, right? Yeah. This is fine, this is good,
Yeah.
yeah.
Okay, Weather Pros has an updated website. The problem is, as I found out, it's a great website, but it's $82 a month, so scratch that.
Mm-hmm.
I'm still looking for some sort of weather connection so that maybe we can have sort of, hopefully, a heads up, a better heads up than watching TV. Because that's not a good heads up for this area, as we well know.
Mm-hmm.
All we have to do is go back to 2008, when they told us, oh, it's just going to be a rainstorm. It was not. I'll keep looking and see if I can find something that's good but free. Okay, new business, all right. So I gave you a copy of the safety calendar. And like I said, I accidentally printed out there is a folder, there is another piece to this alert media. that has a how to do it manual, but I'm still studying that, so even if I had it here, I wouldn't be able to really, talk about what next steps are, cause the first step is to decide what we wanna concentrate on. We need to do a tabletop. The DPH has said that they want to have a tabletop, and they said that they want DPH to be they want Board of Health to be the lead on it. To which a lot of the Board of Health people said, huh?
Yeah. That's
So,
something they usually do.
yeah, cause that's not their thing, it's not really it's not their ballpark. So, I mean, they got the EDS plans and everything else, and that's their ballpark, but this is not a tabletop, it's not really their ballpark. But DPH wasn't listening. They kept arguing throughout this whole meeting that, that you need to be doing a tabletop by December 31st, and they want an after-action report, and they want it to be as professionally outlined and put together as possible. And they wanted police, they want the selectmen, and they want the fire department, and of course, Board of Health, they're going to be the lead. Anybody that's going to be part of EMS, they listed EMS as well.
So is that to test the emergency dispensing plan? What?
It's supposed to be a step up above that.
Okay, so what are they testing?
They want you to pick your subject. In other words, what'd you say, Worcester's doing
Yeah,
heat?
they're gonna do
A heat
heat.
emergency?
Yeah,
Okay, so it's.
And then
it's
they
not
want,
just a public
they
health
want
thing.
you to put together a scope, they want you to put together the whole thing. So, and then they want you, if you can test it, test it.
Yeah, well,
Get everybody
tabletop would be a
together.
test, yeah.
Get everybody together. People were telling, we haven't even done the first step of a tabletop, of
Right.
getting together and talking about who does what. So we haven't even, nobody's done that on the Board of Health level. So, and a lot
I
of
don't
little.
think we've done that on any level.
Right, a lot of little
So-
towns, yeah, that's exactly it. Royalston jumped in and said, we haven't even done that, we're a little town. How do you expect us to do that? So, there was a lot of discussion, like DPH just sat there and said, it needs to be done by December 31st, and I need to have an after-action report on my desk.
So what's the consequences of not doing it?
Well, that's what's the thing, somebody asked that,
Exactly.
and they said, well, what if we don't do it? You need to do it, was the response, so I don't know what the consequences would be.
Sounds to me like there are no consequences if you don't do it. That's what it sounds to me.
They'll just nag you to death until you do get it
Yeah.
done.
I mean, I think that
Because that's
first-
what they did with EDS, they just nagged us to death until we got the plan.
And then when COVID hit, they just threw those plans
threw
out the
it all
window
out.
anyways,
Yeah, that's the piece that bothers me, is that we're gonna do all this work again,
yeah.
another disease is gonna come along.
Yeah.
We're gonna scramble to get, to follow through on our EDS plans and then they're gonna throw it all out.
If they're just looking for the collective work of the town, with Board of Health being lead, but, which is silly on any subject, in certain subjects it would work, but, if they would take anything, the easiest thing to do would be like, okay, we did an ice storm before, how much better prepared are we now with the plans we've done since then?
Mhm.
That would be the easiest to put together.
I asked that,
Yep,
and they said that's a natural disaster, we want something that's public health.
okay, so it's gotta be public health related.
so I had some thoughts that, what if there's a new COVID type thing? Since we've been through the COVID, we have this emergency plan for all kinds of disasters. What if we just, go through and say, okay, there's a new pandemic that comes in. We'll just say pandemic X. And how are we gonna handle it? That way, a lot of what we already have in place can be written into the plan easily without a lot of extra work. And we will comply with something that is possible fairly, you know,
Well, what does
by
public health,
comparison.
what does public health have for a written document as a plan to deal with the pandemic? Because you can't test, the exercise they want, the tabletop, is a test of a plan. So if
Right.
the plan isn't written and in place, you can't test it. That's the first step, you have to have a plan before you can test the plan.
Right.
Cause I can
So-
certainly help with a tabletop, I've set up a few tabletops, I'll tell you, if you hire someone, 3-hour tabletop, with an after action, it's gonna cost at least $5,000. If you don't have good plans already in place, it could be more, cause I just set up one recently with a vendor, cause I didn't wanna write the tabletop on that one.
You know, they didn't even discuss that aspect. They didn't even discuss how, they said we wanted to look professional, but that, what does that
Well,
mean?
there's a
You
standard
know?
for after action reports on how they
Yeah.
should be written.
But the
and-
scope, writing the scope
Yeah.
and putting together, what does that mean when you say this needs to be professional?
They should have given you better terminology than that, cause there is a professional standard. Homeland Security has standards for that.
Yeah. I was thinking, you know, tuberculosis. Many years ago, there was a tuberculosis outbreak in Westminster, and they had to scramble as to how they were going to handle that. We've also got, you know, anti-vaxxers, and so we've got now the potential for all kinds. We had a case on diphtheria show up on the Maven. We've had cases, and we've had lots of Lyme disease, you know, but that's kind of under control. But, you know, we still have potential for measles, and there's all kinds of, you know, potential now, especially as the anti-vax folks expand and grow in numbers.
Yeah. I mean, I think
So in
if they're gonna force us to do something, I would pick something that's fairly simple
Yeah.
to write a plan, to have a written plan for, and then,
Well, there should be a general plan for handling a public health emergency, and then like different levels of it, whether something that's, you know, airborne, something that's, you know, environmental, like Lyme disease, you gotta keep it, all hazards types.
Yeah.
You know, so that you don't have to have a plan for 15 different diseases. But the public health has to have that, and I don't know what public health has for a plan. If they have a plan, I will help with a tabletop, and the after action, I know what the standards should be, and I know how to put them together, but you gotta have a plan first.
right.
If someone comes up and says this is what their plan is, I will certainly help with it. And I'll only charge $49.99.
All right, well, we'll put our heads together, right, Judy?
Yep. Yeah. That's why I gave you the calendar, because the calendar is like chock full of ideas, and so that would maybe a possibility of that we could pull something off that you wanna flip through it and see if anything catches your eye. I kind of was looking at suspicious packages as well. That would be an educational. Disease spread prevention. There's water safety as well. We have end up with contaminated, watersheds. Well, that's pretty remote, but. There's a lot on, internet safety too, that's where you get all the misinformation, the disinformation, and malinformation as well.
I like when they used to just say it was a lie.
Yeah.
Yeah.
One word, it was a lie. It's either true or it's false.
issue. You know, I don't wanna, if they're doing heat down in, Worcester, I don't wanna be doing the opposite, of what they're doing. I do something a little more unique. That's just me. So, all right, so we'll keep looking, we'll pick a topic, and then we'll work with Tina, see what we can do.
Pick a
Thank you,
topic,
Tina.
develop a plan, then we should get that plan ahead of time so we can go over it.
Yeah,
you guys
right,
can go.
definitely.
You know?
Yeah,
Yeah,
Yeah.
you
That's
need
the
a good
whole
planning
idea.
session with it.
Yeah,
so that we can then just
Yeah,
say,
I
here
mean,
it
they were
is.
talking
Right.
about it, and when, at this meeting, they were talking about, you know, well, you would take your position, your security, and you would take your position, and you would take your position, and I'm thinking, you know, a lot of us were thinking, is that we're not even close to that, you know?
right.
We were close to that. I think if something happened like 2008, we sort of looked at each other momentarily, and then, thank goodness for Ron Newton, he said, well, there's a whiteboard here, let's see what we can do with that, and then we went from there. And we did just fine once we did that. And that's exactly how it went.
Right.
In 2008.
Yeah.
Ah, there's a whiteboard, so why don't we do this? And then from there, that was
Well,
our
that's how-
plan.
Yeah.
Yeah, I mean, we have a plan now, how to, it's been addressed here as this committee,
Right.
but the whiteboard is your work,
As long as you're
Yeah,
fail safe
it's
anyways,
workhorse.
because you don't need
That's your
electricity.
yeah.
Yeah, exactly.
That's on my EPG for next year, and I'm not letting anybody else have my money. We'll get, how big do you want the whiteboard to be, guys?
As big as possible.
All right. I'll see how big I can get it.
Portable, but as big as possible.
The last, tabletop drill that I participated in was a little scary for me because it was the first time I'd been involved in it. And, but their whiteboard was pretty much the length of that wall. And we went from there. They said, okay, we have the whiteboard. And that's exactly how it went from there. So we'll do that. Okay. So that's it. So the next meeting is, I think maybe it's because we had this stupid December 31st. Shall we meet again?
Yeah, we'll have to meet again at some point here before.
I mean, if there's no consequences at this point for the DPH's thing, at least if you have progress towards it,
Right.
Right.
it usually pieces them.
Yeah.
Yeah,
it's-
if it doesn't happen before then, we do it soon after, then I wouldn't worry too much about
Yeah,
it.
evidently somewhere in their plan, they put that all boards of health across the state will have a tabletop drill, and that will be the deliverable. That's what they're,
Or else,
and so now they're gonna have all of their community liaisons
Right.
coming. So that means Jamie will be wandering through. Oh, she retired, so I
She
don't
went
know
to a
who-
different position.
Yeah, so I don't know who will
I
be
would
wandering
say we
through.
Maybe
come up with
Pamela
what we
Mansfield.
can come up with
Yep.
and then
She's
work
supposed
on
to engage, not
work on a meeting
state.
date to go over the
Yeah.
plan and then work on a
She's-
date where we can do.
So
That's
we
what
have the
I'm saying.
clinic.
Yeah.
Meet their demands.
We have the clinic, on the 17th, 18th, so what if we make it the end of October after the Halloween thing? Cause I know
So-
you will be involved in the Halloween
Is
thing,
somewhere after the,
first of November.
somewhere after, yeah, within the first couple weeks of November there. I
Early
would
November.
suggest.
Alright, look at your calendars if you have them.
First Tuesday and Thursday afternoons are out for me because of meetings.
So can we move it to another day?
Yeah, I'm just saying that the first Tuesday and Thursday are tough for me. Everyone likes to
That
carry
first
forward.
week?
Yeah.
First week, so the second week is open.
Yeah.
Okay.
The 11th is Veterans Day. So we'll do that day.
Do it on the 11th.
No, not the 11th is what I'm saying. Don't do it on the 11th.
That would be a perfect day, everybody's free.
Yeah. I'm free, but not free.
Yeah.
Yeah, we wouldn't wanna do it on the 4th anyways, cause that's election day.
Yes, exactly.
Times.
Okay. So the 11th, on Tuesday?
Wednesday the 12th?
I could do the 12th.
Yeah, Wednesdays are decent for me usually.
I
You
tutor,
wanna
but,
do like 3 o'clock again?
alright, I tutor, but I can work around that.
Shoot for that day, the 12th at 3?
That's good.
Alright, and look around, shop around, and see if you can come up with an, I'll send out the outline that I have. If you find an outline, and send it out, then we can kind of all take a look at it all, and
For
we need to,
an outline.
on how to, just so we can spudge it all together.
For a
make a
tabletop?
plan. Yeah.
Yeah, well, just like I said, we need the plan first that's gonna be exercised. That's the key.
Yes.
Mhm.
I've got enough templates to do a tabletop with, it's just a matter of what you're exercising. That's
Okay.
who you invite.
Yeah, and I'll
What you're
see if I can
testing.
find out more information as to exactly what they want in it. So, because that they were,
Well, like I said,
they
it's
just
it's
sort
testing
of
the
dropped the
plan.
bomb
Yeah.
at this meeting, and rather than,
If you're gonna have like an infectious disease plan of whatever level, then that's what you base a scenario on.
Right.
On how you're gonna exercise the plan, you make that scenario, you set up, injects, and you separate the people into, different groups on who's gonna respond, like fire and police, public safety would all be together, and public health would be together, and any other agencies that you want involved, like, even having the selectmen involved, and, okay, what's gonna happen? Well, when this happens, what are you gonna do? When you go to your groups, you work through it, and then you report back on what you would be doing at that point, where you go next, decide what is in place that you can do, or what didn't work, and you can even throw some functional things in it, like calling the rec to do something for you, to send out an alert or something, okay, they couldn't do it, now we know that's a breakdown right there, or something.
Right.
yeah.
I don't know if I picked on that,
And
but.
quarantine, you've got quarantine like level 1, 2, 3, 4, and we hit 4 during COVID.
Yeah,
So, I don't really think, I wouldn't want our plan or our tabletop to go beyond
no, I do this,
quarantine
I do a
one
little
or
more simple,
quarantine 1 or quarantine 2, maybe possibly 2, but I don't think that's just creating too much work and too much of a headache that we're not ready for,
Right.
so.
Okay.
Okay, that's all I have. Anything else, anybody?
How about a market receives product and they sell it to the community and people start getting sick? Like, something like that.
Contamination.
Food contamination from a,
Well, that's a good one.
well, does the Board of Health have a plan for that?
Oh, no.
Okay, then writing the
Then
plan.
you're gonna wanna write a plan for that
Yeah.
before we talk
I don't
about
think we're gonna get a
tabletop.
plan written before then, but that's a good thing to
how
have
about
a
food
plan for.
contamination?
Food or, water contamination is
No,
a big thing here, cause everyone's on a well.
Just say.
Well, I'm
we'll
saying for the
say-
plan.
Mhm.
Mhm.
All right. So we have this infectious disease, and then we have food contamination.
Through,
Market.
yeah, a market selling a product that was brought in commercially that was bad.
We have a number of
I mean, we have local.
farms too, yeah. Farms, and something could happen.
Well, there's like the Country Hen has a plan for like if the chickens
Get sick.
get sick.
Yeah.
Oh, yeah.
I mean, you could use something like that as well,
Yeah.
Yeah, there's
because.
few things that you'd find the same supplier for all of town, cause people usually buy close to where they work, because there's nothing close to where we live.
Right.
Other than Gardner, but, yeah, it could easily be something with contamination with the Country Hen, or if we have a farmer's market going on, a vendor at the farmer's market could certainly
Mhm.
cause something. But like I said, if we don't have a plan in place, you're not gonna get it done before.
Right, no matter what, we're gonna need to make sure that whatever we're picking here, we have a plan in
Current
place, or we can
plan is
develop a plan
Kathy, the
fairly
inspector
quickly.
goes right out and inspects immediately. That's what the current plan is.
Yeah. expensive.
after
Anytime
that
there's an-
is what we need to plan for.
If they
Right.
come up the wrong way, the agriculture workers out there,
Yeah.
I'm just thinking, they bring in, deli meat or something,
Mhm.
and it gets sold as it's supposed to be. However, people start getting sick in the town from something that was brought in and stuff. How would we,
Handle that, right?
yeah, my first day on the Board of Health, way back in the 90s, my first day was salmonella case. Six cases in the town. I said, what? 6 cases in a little town like us?
Mm.
But, yeah, that was my introduction to Board of Health. So, it's a possible.
It's just a thought.
It's a possible.
Yeah.
Yeah. I think that's a good one, even though it's kind of remote, but I think it's a good one. I like,
It's something worth having a plan for, but it's,
Yes.
like I said, if the plan's not already written, we're not getting it tested in the near future. Cause that's
Right.
gonna be a lot of work to have the plan writ, you know, to write it and make sure you know, you vet everything that's in it, if that's what you want, and then to test it is, I think that would take too long. You only got a
Right.
couple months to plan. It's a good future thing.
Right.
yeah.
Infectious
In fact, they said at the meeting, they said, well, you can have your tabletop on December 28th as long as, that'll give you 2 days to get ready. Your
okay.
AAR.
Yeah, write
written
an
and
AAR after
then
2
submit
days,
it.
Wow.
yeah.
Over the
I mean,
There's
there
no
was-
written one.
It's not gonna be done by the end of the year, I can almost guarantee you that, but maybe it will be.
Like I said, if you,
At least a plan.
Exactly,
if you have a plan,
if we
send
have
it
it
to
planned
me.
and scheduled that we're gonna do it
Yeah.
within, I'm sure they'll be like, okay, they're not gonna,
Right, we're gonna say, we will process the rest of this by such and such.
right.
And
That's
he, and everybody needs to know what their roles are gonna be. I mean, that's a study. You can't do that at the table.
Right.
Okay, I guess we got a plan for a plan.
Plan for a plan, sounds good.
All right, thank you
Okay.
all.
Great, thank you.
Um,